All right, today we are diving deep into Graves' disease. You can think of it as a condition that basically slams your body's metabolic accelerator to the floor and just leaves it there. So let's get right into it.
I mean, just imagine for a second you're driving a car and that gas pedal gets completely jammed. You can't slow down, you can't stop, you're just rocketing forward. Well, that feeling is a really powerful way to understand what's happening inside the body when Graves' disease takes hold.
So, how in the world does this happen? Well, it all kicks off with what is basically a case of mistaken identity. It's an inside job, really, where the body's own defense system, the immune system, makes a huge mistake and starts attacking itself.
So, to put it formally, Graves' disease is an autoimmune disorder. Your immune system, which is supposed to be your bodyguard, gets its signals crossed and goes after your thyroid gland. But here's the twist: instead of shutting it down, the attack actually supercharges it. This leads to what we call hyperthyroidism. And believe it or not, Graves is the single most common reason for an overactive thyroid.
Now, the main player in this whole drama is a very specific type of antibody. It's called thyroid stimulating immunoglobulin, or TSI for short. The best way to think of TSI is as a rogue agent, a perfect imposter that mimics one of the body's most important hormones. So how exactly does this imposter antibody pull off such a major heist? Let's break down the step-by-step of how your thyroid gland actually gets hijacked.
It really is like a domino effect. First, for some reason, the immune system starts cranking out these TSI antibodies. Now, your brain normally sends out a hormone called TSH to tell the thyroid when to work. But these TSI antibodies are masters of disguise. They look and act just like TSH. They bind to the thyroid's receptors and essentially hotwire the whole system. The thyroid is totally tricked and it starts pumping out way too much of its own hormones, T3 and T4. Your brain, of course, sees this flood of hormones and immediately hits the brakes. It stops sending its own TSH signal. But, and this is the key, it doesn't matter. The imposters, the TSI antibodies, are still there, keeping that accelerator pushed to the floor.
And the result of this constant hormonal flood? It's a body that is literally stuck on fast forward. Every single system is running at this frantic, unsustainable pace. Medically, we call this a hypermetabolic state.
You can see this whole conflict play out perfectly in your lab results. The brain signal, TSH, is going to be incredibly low. Sometimes it's nearly zero. That's the brain screaming, "Stop!" at the top of its lungs. But at the very same time, the thyroid hormones, T3 and T4, are sky high. And right there, that's the classic signature of this hijack. The brain is desperately hitting the brakes, but the thyroid's engine is just roaring, completely out of control.
So what does being in a hypermetabolic state actually feel like? Well, your body is burning through calories so fast that you could be eating constantly and still be losing weight. You feel restless, hyperactive, nervous, anxious, and here's the real irony. Even though you are always on, you feel deeply exhausted because your body never ever gets a chance to rest and recover. You might even notice your hands have a constant fine tremor.
Okay, so we've got the internal chaos down. Now let's talk about the classic external signs. And luckily, there's a really simple and powerful way to remember the main symptoms of this condition. The absolute key to remembering the clinical signs is this simple phrase right here: hot, high, and bulging. So let's quickly unpack what each of these means for someone experiencing this.
First up, we have hot. That overactive metabolism is basically a furnace running inside you 24/7. It generates a ton of excess heat. This leads to feeling hot all the time, sweating more than usual, and just not being able to tolerate warm weather at all.
Next up is high, and this one points to the really serious overstimulation of your body's systems, especially the heart. We're talking about a high heart rate, called tachycardia, often over 100 beats per minute at rest. This can cause palpitations and even lead to dangerous heart rhythm problems like atrial fibrillation or AFib. It also means high blood pressure and, as we mentioned, high levels of anxiety and hyperactivity. Basically, everything is turned up to 11.
And finally, we have bulging. Now, this is the really distinct one. This is a sign that is very specific to Graves' disease itself and not just any old cause of an overactive thyroid. We're talking about a condition called exophthalmos. You see, that same autoimmune attack that goes after the thyroid can also target the muscles and tissues behind the eyes. This causes inflammation and swelling, which physically pushes the eyeballs forward. This creates that very characteristic bulging or staring look that is so unique to Graves.
So, how do we put all the pieces together and confirm the diagnosis? Well, the lab results tell the exact story we just walked through. TSH is low because the brain is trying to shut it all down. T3 and T4 are high because the thyroid is in complete overdrive. And then there's the smoking gun, a positive test for those TSI antibodies, which confirms that this whole mess is in fact an autoimmune attack.
And all of this leaves us with a pretty profound final thought. Graves' disease is essentially a civil war inside the body. Your own immune system is the one leading the charge. It really makes you wonder, when your own body is the enemy, how do you even begin to declare a truce?